This video shares breastfeeding experiences of immigrant women during the COVID-19 pandemic. This study was undertaken in Saskatchewan, Canada. Dr. Sheila Harani and her team acknowledge the support of Saskatchewan Health Research Foundation that funded this study. We acknowledge that there is no actual or potential conflict of interest. During COVID-19, I was worried that my baby's immunity would be reduced, so I kept breastfeeding my baby.
Due to the COVID-19 pandemic, I was at home most of the time. This helped me to breastfeed my baby.
The only benefit of the COVID-19 is that I spend more time with my family and can breastfeed my baby.
After my childbirth, I tested positive for COVID-19. At that time I was sad because I didn't have the chance to carry my baby immediately, do the skin-to-skin contact and breastfeed my baby. It was not easy being away from my baby due to COVID. I was somehow depressed and sad. During my stay in the hospital during COVID-19, after my childbirth, I was in isolation. No visitors were allowed, and nurses even refused to take a picture of my baby with my phone, citing to reduce the contamination risks.
After giving birth to a baby, restrictions on visitation cause postpartum depression because you don't have people to cheer you up.
Due to COVID-19, most of my appointments were over the phone. Even when I had concerns, they were still heard over the phone.
It would have been nice if a lactation consultant could come to my house, but because of COVID-19 it was impossible. They were restricting visits.
Due to COVID-19, we stayed home in isolation. I couldn't meet anybody, couldn't invite anybody and couldn't go anywhere.
As a breastfeeding mother, I was about to give up. I was a first-time mom and no one was allowed to visit me at home or in the hospital.
I did not have any community support. As a new mom, I wish I had more support at the hospital since no one was allowed to visit me during COVID-19, which made me depressed and sad.
As a new mom, I had to stop breastfeeding due to COVID-19 and look for a job as my husband was laid off. Financial hardship, loss of employment and lack of financial assistance from the government wasn't enough for us to pay rent and feed the family.
We need everyone's support to sustain our breastfeeding during COVID-19.